Hello, students. Welcome to chapter 42, part 2. We are talking about eye changes. Oh, wow. We are talking about eye changes associated with aging. Um, so we spoke about visual acuity before in the previous part of this chapter. We spoke about the structural changes when I showed you the videos about the anatomy of the eye and how the eyes are moving. We spoke about the arcus senilis. I made a brief comment about how nurses needs to address the nutrition in terms of lipids. And right now we are talking about functional changes also occur with aging. The lens yellows, hardens, shrinks, and lose elasticity, which reduces accommodation, right? And we know accommodation is the fast reaction when somebody is seeing far. For example, if the doctor asks you, could you please see the wall, and then come closer and see my finger, right? So the doctor is going to put the finger in front of your eye and is going to ask you to switch. Please look at the wall, look at my finger, look at the wall, look at my finger. That's fastest accommodation. Okay, the near point of vision, the closest distance at which the eye can see an object clearly, increases. Near objects, especially reading material, must be placed farther from the eye to be seen clearly, presbyopia. The farthest point at which an object can be distinguished, decreases. Together these changes narrow the visual field of an older adult. Okay, so we can see in this picture the arcus senilis. General color perception decreases, especially for green, blue, and violet. More light is needed to stimulate the visual receptor. Intraocular pressure is slightly higher in older adults. So we have the health promotion and maintenance part of this chapter. Teach adults about eye protection methods, adequate nutrition that supports eye health, and the importance of regular eye examinations. Okay, let me make a parenthesis here. And this is for in general, okay? Not only related to the chapter, is the way you have to study for your NCLEX. You need to know the concepts of procedures, but what you are really getting tested about is the pre and post procedures in terms of nursing care. Your NCLEX is full of that. Don't get scared with the big names. For example, in the stem of the question, you are going to see the paracentesis of or maybe endoscopy or retrograde cholangioma procedure. You need to know the concept of that procedure. They are not gonna test you about how the procedure is done and if the camera is inserted and the muscle that are being seen. No, you're gonna be tested on how to prepare the patient for that procedure, pre and post procedure. Okay, and all the safety measures to avoid infection. The same thing with the eye. With the eye, you need to teach the patient about nutrition, how the proper technique for putting the eye drops is done. The same for the ears, right? So pay attention to the nursing safety little paragraphs that are here in the book, and all the nursing care, nursing procedure, nursing safety. That's the most important for you to pass the NCLEX. Okay, teach adults to protect the eyes by using sunglasses that filter UV light whenever they are outdoors, at tanning salons, and when work involves UV exposure. Vision can be affected by eye injury, which increases the risk for cataract formation and glaucoma. Teach adults to wear eye and head protections when working with particular matter, fluid, or blood spatter, high temperatures, or sparks. Here we have to make a special remark on barbecues. Okay, barbecue, you are going to have high temperatures. You are going to have these little particles coming from the charcoal Okay, so you need to wear special protection for your eyes, especially in these activities. Protection should also be worn during participation in sport or any activity that increases the risk for the eye being hit by objects or motion. Teach adults to avoid rubbing the eye, to avoid trauma to outer eye surfaces, especially to those adults also that love to to bike. They love to go around in their bicycles. There's a lot of particles coming from the air, so wear your glasses, your helmets, right? Common sense. Eye infections can lead to vision loss, although the eye surface is not sterile. The sclera and cornea have no separate blood supply and thus are at risk for infection. Teach adults to wash their hands before touching the eye or eyelid. Teach patients who use eye drops about the proper technique to use these drugs and not to share eye drop with others. Meaning, if your mom is using eye drops for her dry eye condition, that is her eye drops. You are going to use another bottle of eye drops if you develop that condition. Also, if the doctor prescribed to you a medication, let's say you got an infection in the right eye, okay, and you didn't finish that medication, you are putting the bottle on the side and you are saving that medication. Later, let's say a few months later, you develop the condition, the same condition on the left eye. Don't you ever think about using the same bottle for the left eye. Get a new bottle. Okay, I'm telling you, because you can cause an infection just for using a bottle with a previous agent. Okay, a causative agent could be a virus, a bacteria, whatever it is. Discard that. Okay, teach patients who use eye drops about the proper technique to use the drugs and not to share drops with others. Yes, if an eye has a discharge, the patient to use a separate eye drop bottles. Exactly, for this eye and to wash the unaffected eye before washing the affected eye. Other health problems, especially diabetes or hypertension, can seriously affect visual sensory perception. Teach patients with these conditions about the importance of controlling blood glucose levels and managing blood pressure to reduce the risk or vision loss. Annual evaluation by an eye care provider is needed, prevent eye complications, and detect problems early. So here you have your basic eye examination frequency. I have lighted whatever I think is kind of important, as Dr. Berg mentioned before. If you are below 40 years of age, right? Um, and you have certain conditions, then you have to increase the frequency of visits to your ophthalmologist. 40 to 64 is every 2 to 4 years. If you have any conditions, of course, it's going to be every year or maybe every 6 years. 65 years or and over of any race is every 1 to 2 years. People with a special risk, like for example diabetes, eye surgery, or trauma, as recommended by the eye care provider, may be more frequent, probably once a year, probably every 6 months. Okay, so it all depends, but these are the basics. Eye care providers may recommend that adults older than 40 have an eye examination annually that includes assessment of intraocular pressure and visual fields, because the risk for both glaucoma and cataract formation increases with age. And that's good to know. Okay. Intraocular pressure once or twice a year. That's good to know. Nursing safety: teach adults to see a healthcare provider immediately when an eye injury occurs or an eye infection is suspected. Don't delay, don't self-treat. Now, if you have an eye injury or let's say a foreign body injury, um, and you manage to get these conditions resolved after one hour or 2 hours, it's not an emergency. But if this condition is staying there, okay, and is causing more trouble in your eye, you need to go. It's an emergency. An eye infection, I wouldn't wait not even 1 day to see the doctor, because you can develop brain infection if you don't treat it correctly. What is the appropriate nursing response when a 66-year-old healthy client asks how often a visit to the eye care provider is recommended? Every 1 to 2 years if you have no eye problems. Of course, if the patient is diabetic, probably it's gonna be seen every 6 months. Okay. Uh, Please take a look and pay attention to the NCLEX examination challenge questions, because I may include some of these in the exam. Okay. Let's go to assessment, patient history. We have to consider about the conditions that the chronic conditions the patient may have, like diabetes, hypertension, thyroid problems. Also, we need to check the full list of medication the patient has been taking, like antihistamines, your Benadryl, decongestion, your antibiotics. Some antibiotics causes itching, like penicillin, amoxicillin, and some other antibiotics like Cipro or levofloxacin causes retinal detachment. Okay, having said that, it's important when we have older adults patients and they are changing PCP for some reason. Maybe they are moving out of states, or they are moving with the family, or they are, whatever the reason is to change PCP, that the new PCP knows the history of the antibiotics that the patients are taking, because that is going to give us a hint of what to order or what to not do not or to avoid, right? In my case as family nurse practitioner. That's why this is very important. Some older adults, they are taking a lot of antibiotics because of UTI or because upper respiratory infections, especially amoxicillin, or probably are taking nitrofurantoin is another medication for UTI. So we need to keep track of those antibiotics and medications and let the primary care provider know about this. Chemotherapy agents also and corticosteroids. More in relation to assessment, the gender is important. Retinal detachments occur more often in men, and dry eye syndromes occur more often in women. The occupation of leisure activities can affect visual sensory perceptions. Chronic exposure to infrared or UV light may cause photophobia and cataract formation, and that's good to know. That's good to know. The UTI, especially these older adults that they have the empty nest, and the daughter, the sons are away from the house already, having their own family. So they spend massive amounts of time traveling around, going on cruisers. They start to having these tanning, sun tanning sessions. Believe me, so they are in high risk to develop photophobia or cataract formation. Okay. Social habits such as smoking or vaping, if they are having a lot of social activities like barbecue, also you have to consider that. Systemic health problems can affect vision. Check wherever the patient has any condition listed. Ask about past accidents, injuries, surgeries, or blows to the head that may have led to the present problem. Those patients in bicycle without helmets, those are in high risk. Drugs can also affect vision, and the eye. We spoke about the drugs. Ask about the use of any prescription or over-the-counter drugs, decongestion, antihistamines, assess for eye dryness, and let them know that this may increase intraocular pressure. Ocular effects from drugs include itching, foreign body sensation, redness, tearing, photophobia, and development of cataracts and glaucoma. Eye dryness, okay. This paragraph here, I want to repeat it again. Ask about the use of any prescription or over-the-counter drugs, especially decongestions and histamines, which cause eye dryness, and may increase intraocular pressure. So some patients are taking these antihistamines like cetirizine, your Benadryl, or other antihistamines to prevent, the seasonal allergies. But at the same time, they are causing the intraocular pressure. Okay, they might increase that or the eye dryness. Okay, nutrition, vitamin A deficiency can cause eye dryness, keratomalacia, and blindness. Some nutrients and antioxidants such as lutein, zeaxanthin, and beta-carotene help maintain retinal function. A diet rich in fruit and red, orange, and dark green vegetables is important to eye health. The way I remember this is I remember my Christmas colors, which is the red and green, right? So you remember your red and green, your red, all your red vegetables and fruits, and orange, and your dark green vegetables. So your Christmas colors avoids your vitamin A deficiency. Keratomalacia is an eye disorder that involves drying and clouding of the cornea, the clear layer in front of the iris, and and the pupil due to vitamin A deficiency. So you don't want to have that if you don't feel, if you as a nurse, you're going to feel very bad if you didn't provide the proper patient education related to vitamin A, right? Pay attention to your NCLEX examination. Let's move to the nursing safety priority. Critical rescue. Recognize that a sudden or persistent loss of visual sensory perception within the past 48 hours, eye trauma or foreign body in the eye, or sudden ocular pain is an emergency. Respond by notifying the eye care provider immediately. As I told you before, you really, if it's related to the eye and you don't have a better situation, better condition within 2 hours, I mean, it's something that you need to schedule an appointment as soon as possible if you don't have any eye clinic close to your house. Physical assessment, look for head tilting, squinting, or other actions that indicate that the patient is trying to attain clear vision. Assess for symmetry. Exophthalmos proptosis is protrusion of the eye, and this is happening in Graves' disease, a disease of the thyroid. Enophthalmos is the sunken appearance of the eye. Scleral and corneal assessment require a pen light. Assess the blink reflex for bringing a hand quickly toward the patient's face. Use extreme caution when performing this maneuver, especially with confused patient. Patient with vision will blink. Okay, I want to say something about this. It's good that you know all these procedures and tests, but basically in the ophthalmology clinic, the clinic of the ophthalmologist, only the high trained personnel, staff, nurses are going to be assessing and making this test. But still, after you do the test, the ophthalmologist is going to come and is going to repeat the test to see if your assessment was correct. Okay, if you feel or you have any doubt about the findings in your assessment, you need to tell the doctor the honest truth, because you're gonna play with the eye. You are playing with the vision of somebody and probably any condition related to the brain. Okay, I really doubt the doctor is gonna allow you to use the pen light and to do the blink reflex and this and that. But if the doctor has trained you, you can do it, but I'm sure the doctor is going to repeat the assessment. Observe pupils for response to light. Increasing light causes constriction, whereas decreasing light causes dilation. Constriction of both pupils is normal response to direct light and accommodation. This is true. Evaluate each pupil for speed and reaction. The pupil should immediately constrict when a light is directed. The pupil takes more than, if takes more than 1 second to constrict, the response is sluggish. Pupils that fail to react are not reactive or fixed. Compare the reactivity speed of right and left pupils and document any difference. And the constriction must be bilateral. Both eyes must constrict at the same time, right? Um, Yes, if you have a patient that is confused, try to avoid this type of assessments because patient can get scared, and when they start moving their head to reject the procedure, in that moment anything can damage or you can injure their eyes. Okay, so be aware of this. Vision testing use the Snellen eye chart to assess distant vision, and that's good to know. Snellen chart measures vision acuity, and that's something that probably the doctor is gonna let you do, right? So you're gonna have the chart, you're gonna have the letters, the numbers. That's the Snellen chart to measure vision acuity. And this is the Ishihara color plate for testing color vision. And also that's good to know. You need to know the Ishihara color plate is especially to measure color vision. Psychological assessment. A patient with changes in visual sensory perception may be anxious about possible vision loss. Patients with severe visual defects may be unable to perform ADLs. That's why you need to assess and you need to address the findings. You need to provide comfort. You need to make the patient to feel calm and confident about every single activity they are going to perform. In terms of laboratory assessment, results of cornea cultures or conjunctival swabs and scrapings can help diagnose infections. If a culture is ordered, obtain a sample of the exudate from the conjunctiva or an ulcerated or inflamed area before antibiotics or topical anesthetics are instilled. In terms of imaging, the CT is useful for assessing the eye, the bony structures around the eye, and the extraocular muscles, whether the MRI is often used to examine the orbits and optic nerves and to evaluate ocular tumors. Okay, it cannot be used to evaluate injuries involving metal in the eye. Metal in the eye is an absolute contraindication for MRI. Radioisotope scanning is used to locate tumors and lesions. This test requires that the patient sign an informed consent, and sedation may be used for those who are very anxious. A tracer dose of the radioactive isotope is given orally or by injection. That's why they are giving informed consent. And then the patient must lie still. Ultrasonography is used to examine the orbit and eye with high frequency sound waves. Inform the patient that this test is painless, that is performed with the eye closed, or when the eyes must remain open with anesthetic eye drops instilled first. The patient is usually positioned upright with the chin in the chin rest, although the test can be done with the patient lying back. Other assessments. You have the slit lamp examination that magnifies the anterior eye structure. You have the corneal staining, consists of placing fluorescein or other topical dye into the conjunctival sac, and then the eye is viewed through a blue filter. The procedure is non-invasive and is performed under aseptic conditions. And that's good to know. This procedure, the corneal staining, the dye outlines corneal surface irregularities in a bright green color. This test is used to assess corneal trauma, problems caused by a contact lens, or the presence of foreign bodies, abrasions, ulcers, or other corneal disorders. Think about those patients that wear contact lens and they forget to remove the lens before going to sleep, and they sleep with the lens inside the eye, and then the following morning is very hard for them to open the eye, so they can have a corneal abrasion. Think about those people that are um, putting the decorations for Christmas in buildings, the supers, or maybe they are putting decorations outside in the street, and they need to handle to hang these lights. And think about the wind, think about the lights moving or start to fly because of the wind, and they can have these problems in the eye. Okay. Tonometry measures intraocular pressure using a tonometer which applies pressure to the outside of the eye until it equals the pressure inside of the eye. Okay, so these are tests you need to be familiarized. It's very important. The most common instrument used by every eye care provider to measure intraocular pressure is the Goldman applanation tonometer used with a slit lamp. And ophthalmoscopy allows viewing of the external and interior structure of the ophthalmoscope. The healthcare provider positions the ophthalmoscope to see the patient eye through the side hole. A red reflex usually seen in the pupil with a reflection of the light of the retina. An absent red reflex in an adult may indicate a lens opacity or cloudiness of the vitreous. The provider can also examine the retina, optic disc, optic vessels, fundus, and macula with this tool. And nursing safety priority. Using an ophthalmoscope with a confused patient is a no-no, or one who does not understand the language spoken at the facility to prevent accidental injury to the eye is a no-no. Make sure the patient speaks English or understand your instructions correctly. Fluorescent angiography, which is performed by a healthcare provider, provides a detailed image of eye circulation. Digital pictures are taken in rapid succession after the dye is given IV. And then explain the procedure to the patient and check out the patient has signed informed consent. You know we are giving IV, and it's still pediatric eye drops cause pupil dilation 1 hour before the test. All the structures that are seen in the ophthalmoscope by direct ophthalmoscopy, the red reflex, the optic disc, look at the light reflection, the fundus, the macula. If you have the chance to ask your ophthalmologist or your primary care provider to let you practice with the ophthalmoscope, you're going to be fascinated to see all these structures, the red reflex, the constrictions. It's going to be it's a nice practice. Electroretinography grabs the retina response to light stimulation. This test is helpful in detecting and evaluating blood vessels changes from the serum drugs. Gonioscopy is a test performed when a high intraocular pressure is found and determines whether open angle or closed angle glaucoma is present. Ultrasonic imaging of the retina and optic nerve creates a three-dimensional view of the back of the eye. It is often used for patients with ocular hypertension or who are at risk for glaucoma because of other heart problems. So let's stop here, take a nice break, and then we'll continue with the third part of the chapter 42.